Hello, hello, and welcome to Dr. Toomer Talks on Tuesday. Although I'm going to have to figure out what I'm going to say if I decide to change to another day. But this is Dr. Toomer Talks. Thank you for joining me. Say hello if you're here. Say hashtag replay if you're listening later. And today we actually have a pediatrician extraordinaire. We have Dr. Emeka Obidi, who is the founder of uh, I blanked, of course. Pediatric Partners in Pediatrics
Partners in
and
Pediatrics.
Family Medicine or Family Health,
There you
and
go.
also the founder of.
Newborn Prep Academy.
Okay, I'm gonna let you do the.
Newborn.
See, this is why I don't do introductions because I always mess it up. What's so sad is I've messed up my own name and my own introduction, so I don't even know why I thought I
I,
could do yours.
I do that all the time.
So I'm gonna let Dr. Obidi introduce himself so we can make sure the information gets out accurately.
Oh my God, Dr. Tuma, you're just the bomb. Well, it is, first of all, just a pleasure to be on here with you. I am just excited. You are one of my favorite people. I just love what you do and
Well, thank
appreciate you so
you.
much. And for
Thank
everyone, I'm Dr. Obidi. I'm a pediatrician. I practice out in Western Maryland, and I am the CEO of Partners in Pediatrics and Family Health, a family practice. I work alongside some amazing family practitioners, and we just partner with our patients to help them achieve optimum health. And I'm also the CEO of Newborn Prep Academy. It's an online education platform where we work with new expectant and recently delivered moms, helping them just know what to expect from their newborns so they can feel confident, caring for them and really enjoy that experience. And it's just been a pleasure to be able to create content along those lines.
Oh, wow. Before we continue, I want to say hello to Chris. Thank you for joining us again. I really appreciate your support. And I wish I had something like that when I had my daughter 25 years ago. Even as a physician, I was
Mm,
lost,
yeah.
completely lost with the newborn and just
Mhm.
terrified.
Mhm.
And living away from my family, even though my mother had come visit, I'd already was scared that she was going to leave soon. So tell us a little bit about what your academy is and what you do.
Yeah, absolutely. And it's I would say maybe about 4 years ago, just part of my growth journey in understanding myself a little better and appreciating myself a little better, got to understand that even within um, my practice as a physician, as a pediatrician, I loved taking care of newborns and I loved the interaction with the new moms. And it just gave me so much joy and fulfillment to be able to come into the room and create this space that was safe enough for them to just unburden all the concerns and all the worries, um, and but also realized, looking back over the years, that there are all these concerns that moms have, especially new moms, that you just wish they had that information before the baby came, because it will save them so many hours of worry. And oftentimes it's not like they have the pediatrician at the beck and call where they can, just reach out right away to get that question answered. So they're waiting at the very least, a whole 24 hours, and in many cases, days or weeks before they actually get into the office to ask the question, only to find out it wasn't actually a big issue after all. And so, really got to put together content to speak to those issues that I found moms worried about all the time. That if they just knew about it, was going to be very helpful. And yeah.
Well, I can tell you, I know that's just an invaluable service. Um, I'm just going to tell a quick story from when I first had my
Yes.
daughter. She, my, she had colic,
Mm.
and I called her per
That's hard.
pediatrician, and I wasn't sure if she had colic. I was like, something's wrong. I don't know what's happening. I
No.
called her per
Yeah.
pediatrician. She was like, Catherine, what do you think it is? I'm like, I don't know. She's like, Catherine, please put on your doctor hat right now. What do you think it is? And I said, I think it might be gas. And she said, well, did you give her some simethicone? I'm like, is that, I still asked her, is that by prescription? Catherine, please put your doctor hat on. For those you don't know, some of the corners over the counter. It's a
Those gas
medication for
X.
pushing babies for gas, and I my I had new mom brain, and I could not even think through
Yeah.
anything, and I was terrified that I was doing something wrong with my baby. So, if I had had something like an academy and someone who could help walk me through and teach me, that would have been amazing.
Well,
Really.
I'll tell you that, those experiences aren't just with the moms themselves. Even I, as a dad, as a pediatrician, I'll tell you one other story, a story myself too. My daughter was maybe, I don't know, maybe 3 months old or something. I had done this overnight shift, came back, in the morning, and my wife was there, very flustered, saying that she has a fever. So I, took her vitals. She had a fever. I don't know, it was 102 or 103 point something. I listened to her heart. It was like, racing away. I'm like, oh my God, her heart is beating so fast. She's going to die. let's, let's get up to the ER. So I'm racing to the ER. Of course, I meet all my colleagues there. I'm like, oh my God, there's something wrong with her. Her heart is beating so fast. They're like, she has a fever.
Like, you give her anything for the
we
fever.
expect her heart rate to be high because she has a fever. I'm like, oh yeah, that's true. That's physiology.
Yeah. So, yeah.
When
So
it's
what
yours,
you're
you just
doing is an invaluable service. So let me ask
thank
you
you.
this. So who gets access to that service, to your academy?
Yeah. So first of all, there's content online. I produce that at newbornprepacademy.com, and there's also a YouTube channel that they can search. So lots of content. I try to send out some content every week, and just answering all the basic questions that moms have or dads have. And I have a course, and it's called the Newborn Preparation Course, and that you can access on newbornprepacademy.com. And it really goes through all the basics, how to first of all prepare yourself mindset wise for this baby that's coming,
Mhm.
how to, think about what you're going to feed the baby or how to feed the baby. Some common breastfeeding questions that come up, some common formula questions that come up when you're feeding formula. Things around baby's poop. There's always a big issue. The poop, like what color is it? How often? It's too much? It's too little? It's the wrong color. All the questions about poop and caring for maybe circumcision sites and just a whole bunch of little questions, traveling with your baby. So we cover all of those. And safe sleep, and how to create that environment for sleep, and also how to sleep train your child, when to sleep train your child. So a number of those topics that I find help you really navigate that first several months
Mhm.
are covered on the course.
Oh, wow. So, yeah. So just so you know, so you can go, I have it going along the bottom, newbornprepacademy.com.
Yes.
All of this information. Actually,
Yeah.
now and not just for you. If you don't need it, you can always send other friends. It can be something that you can share
Absolutely.
with your family. Anytime you go to a baby shower, what
Yep.
that's good
Yep.
information for someone to
Yeah.
have. Um,
Yeah.
and so, how much comes up about mom, like post baby body with the mothers?
Mm, mm.
Is that something that's often discussed or that parents talk to you about when they come to see you with their newborns, at all?
Yeah, not directly. Oftentimes it doesn't come up, to be honest. And it's sort of interesting now that you asked that question. I probably should find some way of teasing that out, like,
Mhm,
or creating, maybe figuring out a way to create an opening where they could share that,
mhm,
But we do talk a lot about mom and how she's doing herself and her
mhm,
mental health, which of course plays into that too, right?
mhm.
And how she's managing the stress of caring for a newborn, and navigating that, and whether she has enough support or help at home. Yeah, and all those questions.
And I would imagine a lot of those questions are usually directed towards her obstetrician or OB at
Yeah,
their
yeah,
postpartum
yeah.
appointments, but I just thought I'd ask.
Yes,
Um,
no.
and so but that brings me to my next question. As a pediatrician, you must get parents often coming to you about their children who
Yes.
are gaining weight, who they
Mm,
feel are over it, because we always measure, every child's height and weight, and we always have to, plotted on a
Yes.
map,
Yeah.
and then parents
Mhm.
always want to know what percentile is my child. What do
Yes.
you tell parents whose children are on the upper end of the percentile or even over, and who are having weight issues in their mind, or even maybe medically they are having some
Yeah.
weight issues?
Yeah. Yeah. That's always a very tricky issue to navigate, and it's really very dependent on the patient.
Mhm.
I think one of the reasons I love pediatrics is the fact that you get to oftentimes follow these families over a period of time, and so you develop a relationship with them and a rapport with them. So I think it is easier for me to broach the topic. All right, like you're correct. At every well child exam, there's a weight and height is taken, and we have the growth curve that we take a look at. I think that I try to, well, when I plot the weight and height up on the growth chart and I see where they are, and if there is an issue with weight, I try to assess the family and where my relationship is with them. There's some families that can just sort of come out and just say it,
Yeah.
and both the child is comfortable with me, the parents comfortable with me. It's something I can bring up, right? There's some families where maybe it's a newer family I'm just meeting, or they've always been guarded, and so I had to figure out how to bring that up. I find that sometimes just looking at the growth curve, the growth chart, um, it for me a place to start that conversation oftentimes, and I really am very careful to really phrase in such a way that, okay, we want your child to be healthy, right? And of course, it's not just the weight that makes them healthy, right? Unhealthy, or is not, that's not the only measure of health, but
Mhm.
oftentimes it is. And so we kind of talk about that, and I try and see if they have any insight into why they think the child is above their expected weight,
Yeah.
and see where they go with that.
Mhm.
If they're open to the conversation, I oftentimes, the other thing also I try to assess also is where the parent is with where they feel they are in the picture of their child's weight. Do
Mhm.
they feel it's just a child's problem, and we just need to fix it for the child? Do they feel like, okay, we're all going to collaborate and work on this together? Because oftentimes, the 10-year-old isn't buying anything or
Yeah.
bringing any food into the home.
Yeah.
Even the 12-year-old oftentimes is not bringing it. Yeah, they may eat, some things outside the home, but there's still a lot of what the child is consuming is still within the home, and oftentimes within control of the parent or the guardian. And
Yeah.
so if I can get them to see that this is something we all get to do as a family, we're all going to eat healthier. And then I think what I've found to be successful oftentimes is trying to help them identify one small step we can do
Mm.
to start that process.
Okay.
Can we change what we drink? Can we just make it a 0-calorie drink? Can we? I just had a conversation with a 16-year-old today,
Mhm.
the 14-year-old today, and asking her what she drinks. And she says she drinks a lot of water, but sometimes in school they serve lemonade. So I said, okay, how about we, make the glass half lemonade, half water, right? And
Mhm.
just, that will be at least one step towards reducing the amount of calories you get in your drink that is not helpful. And she'd already made some progress. She had lost some five pounds. So it's a lot of really trying to meet them where they are and
Mhm.
seeing what little step we can take towards getting to a healthier weight. And of course, part of that is going to also be screening to make sure there are not no medical issues, right? That they
Mhm.
and so some will oftentimes just send some basic blood work, make sure that there is a thyroid issue or some other hormonal issue, looking for signs of maybe polycystic ovarian syndrome in the girl, and making sure there aren't other medical issues for the weight.
Okay. As we can, before we continue, I just want to say hello on Cynthia. Thank you for joining. She says hello to you too, Dr. Obidi.
Hi.
And Dr. Una, the infamous Dr. Una is here. So
Hi,
hello. Thank you
Dr.
for joining us. It sounds like a lot of what you do is very similar to what we do with adults. and that you look for the underlying cause, and that
Mhm.
weight gain is a symptom, and there's some reason,
Yeah.
either some biopsychosocial system. I would
Mhm.
imagine with pediatrics, it's a lot of psychosocial
A lot of
and
psychosocial.
less bio, and then with with adults, it's more. How much are you seeing in what used to be adult diseases in children, like type 2 diabetes,
Yeah.
um, or even hypothyroidism, which we didn't
Mhm.
really see very much in children, but
Sure.
you're starting to see more and more. Um, and of course, some of that is from the hormones within meat and the foods
Mhm.
that we're
Mhm.
eating, or even in the plastics that we're using.
Mhm.
But are you seeing more of that? And if so, are families resistant to the treatment or to the understanding of what that is in their child?
Definitely seeing more of that.
Okay.
I think I find that families are beginning to become more aware also that that's a problem in a pediatric population. Because
Okay.
a lot of times I will have them say, "Oh, can we make sure they don't have diabetes? Can we, run a basic test and make sure that they're not diabetic?" And a lot of times, oftentimes, there's someone else in the family, a cousin who has been recently diagnosed as, a type 2 diabetic, even though they are a child. And so I think there's more awareness.
Mhm.
I don't find a lot of resistance in bringing that up. Now, of course, it's going to be a few times where they're like, no, that's never going to happen. But usually parents are beginning to become aware that it is a problem.
Okay. Yeah, I remember when I trained how many bloody years ago,
Yeah.
it was called adult onset diabetes,
Yes.
and not
Hmm.
anymore. We had to change the name
Yeah.
because it's not always adult onset anymore.
Mhm.
So I have a question. I noticed that you are actually in the process of trying to find more doctors for your practice. And
Yes, I am.
because I have quite a few physician followers who listen and who follow. I want to give you the opportunity that if there's any pediatrician or family medicine, whoever's out there who might want to work with an amazing physician in Maryland, I want to give you. I know I just put you on the spot.
You certainly did, but thank you. Absolutely, completely fine. Yes, we would love to have a rock star pediatrician of family medicine physician come join our practice. It's out in beautiful Western Maryland, and I promise I'm a wonderful colleague to work alongside. But it really is a great practice. I think it's one of the things I worked very hard and still do is creating a wonderful supportive environment here at the practice, where people feel seen and heard, and it really just goes along with um, the sort of environment I create for our practice, for our patients also as a practice.
Yes.
And many years ago I changed my philosophy or my focus on making sure everyone was treating the patients very well,
Hmm.
to making sure I was treating team members very well, because they in turn will just treat the patients
Hmm.
great, and so I take great care in doing that. So yes, we are looking to expand, and we're looking for amazing clinicians who can come along. It's also a very unique family practice too, because it is
Hmm.
heavy on the pediatric side, which a lot of family practitioners who would love to work with the full spectrum don't always get that with a family practice. They
Yeah.
usually end up being stuck with working with mostly adults and maybe older teenagers. But at a practice here, you'll definitely work with every age group, which I think is a plus if that's something you love to do.
Oh, well, great. It would have been a place I would have loved to have been when I was in practice, but as you know, I'm not. And I'm in South Carolina, so I'm a little bit further. But sorry,
Move
I didn't
on
mean to
down
put
to
you on the
beautiful
spot.
Maryland.
But so when you say Western Maryland, like what area is that? Just out of curiosity.
Sure, it's Hagerstown, Maryland. So
Okay.
it's a really interesting area because we're about an hour away, hour 15 minutes away from DC, and an hour 15 minutes away or so from to Baltimore.
Okay.
And we're just on the border with West Virginia, which is beautiful for those who love nature. And we're right close to some parts of Virginia as well. It's a really nice area, actually,
Hmm.
with
Yeah, that
beautiful
whole area is
schools
really
too.
nice. Okay.
Yes.
Well, I I'm so happy that you came to join me finally, because we banter off each other quite well. Um, and so I just want to reiterate, because I'm not the only one saying this, but weight is a symptom. There's a biopsychosocial reason. If you have children and you're concerned about their weight, you really must also look inward and figure out what's happening at home that is contributing. And then also make sure there's not some underlying biological issue, like some hormonal
Yeah.
issues. So always, always, always speak to your pediatrician or family
Yes.
physician about your child if you're concerned. So, any last words, Dr. Obidi?
Sure. I will say that to all the moms out there, first of all, hats off to all the things you do. And to those who are going to be expecting a baby soon, just know that um, you can definitely arm yourself with information that helps you better care for your newborn. And also, really, I meant to say this earlier on, to give yourself grace for the changes that are going to happen in your own body also, and knowing that that's part of the process of caring for a newborn, and that learning to just prepare yourself to love yourself through that difficult season, and to know that you're not alone. And please, please, please reach out to your pediatrician, and definitely lots of support and content on the website newbornprepacademy.com, where you can get some good information that hopefully helps you along the journey to care more confidently for your newborn.
Oh, that's great. So that's for any new mom, expecting mom, and
Yeah.
friends of new
And
moms
friends
as
of,
well, and
yes.
or parents, actually, I should say,
Yeah.
or anyone who is interacting with anyone who has a newborn. This is wonderful information. It's a great resource. So definitely look into it. Well, thank you, Dr. Ovidi, for joining me. And I really, really enjoyed this. And I hope that you did too.
It was a pleasure. I had a wonderful time being on here with you. Thank you for all the work you do. It is such important work.
Oh, thank you. All right. Good night, everyone. And thank you for joining us. And of course, there we go.